All things Northern Louisiana Medical Center. Kathy Hall in the studio. That's Mr. Mel McDaniel here on the Q 94.1. Rick Godey, happy to be here with you on this Thursday before Christmas. I even said Thanksgiving last time, but don't tell me that doesn't happen to you. All of this chaotic confusion, cacophony that's happening, and somebody that navigated through the COVID cacophony, is Kathy Hall, our guest here, and she is the CEO of Northern Louisiana Medical Center. Merry Christmas, and how are you there, Kathy?
Good morning. Merry Christmas. I'm great this morning.
All right, well, let's start with the exciting news. Northern Louisiana Medical Center. Well, first of all, how long have you been in your capacity as the CEO?
I have been the CEO at Northern Louisiana Medical almost 2 years now.
2 years. When you got here 24 months ago, did you know this was in the plans, in the works, what's fixing to happen?
I did.
Oh, you did?
Yes, I did. I worked for Allegiance Health Management, and I was at another hospital that they own.
Mm-hmm.
And I knew that when we purchased Northern Louisiana Medical Center, our goal was, when we made the purchase, was to provide for this community a new hospital that it deserved. So that was in our works from the beginning.
All right, so you knew that then. First of all, let's go back. I like to, in the book, usually people begin in the beginning, the genesis, if you will. Give us a little bit of a history of who you are, where you're from, and what drew you into the medical profession.
So I'm Kathy Hall, and I live here in Ruston. We moved here in 2006. My son started Cedar Creek in 1998, so we've been a part of the Ruston community for many years. And so we navigated here because this is where he was at school.
Mm-hmm.
I graduated Louisiana Tech, my husband did, and our son did as well. And I'm a registered nurse. And so that's kind of how I started in the healthcare industry, was as a registered nurse, and then went into administration, became a COO of a small critical access hospital that's owned by Allegiance Health Management in Arcadia, and then went to Winfield, Wynn Parish Medical Center, and then when we purchased Ruston, they relocated me to Ruston.
What motivated you growing up? I mean, at age 6, 7, 8, 13, you say, you know what, I have the heart to care, I want to become a nurse. What was your inspiration?
Well, honestly, my inspiration, I did it later in life. I had an uncle that was very sick, and my family, my parents, we always had people living with us that we helped. And so when my uncle became sick, it became a passion for me to take care of people, and that's how I kind of went into the healthcare field.
Well, as you know, it is a calling and not just a profession, and that is Northern Louisiana Medical Center. Talk about the evolution, if you will, or I should say the progression, because you had groundbreaking, you and who else was in town in the picture? I'm going to show the picture when you broke ground.
The owner of the company was here, right borderline, the owner, CEO, Don Cameron, Chief Operating Officer, Scott Prouty, Executive Vice President, Joe Mansour, which oversees our home health and hospice, and Sam Fulton is our physician recruiter. We also invited Mr. James Davidson to come over and Mr. Ronnie Walker, because they're an instrumental part of what we have going on, and so we invited them to come over as well.
Kathy Hall, our guest here on the Q 94.1, talking about the groundbreaking, which, by the way, commerce and celebrity is the corner that you are at, right?
That's correct.
Talk about the facility that's going to be constructed.
So our vision is, we marked the land because there had been a lot of conversation in the community. We were able to announce it. We signed the papers on October the 7th. So we wanted to get a sign out there so we could officially let everybody know where the property was going to be. The area where the sign is, our goal is that the hospital will be in that area right there on the corner. And then we will have a couple of medical office buildings in that area as well. So it is that area has become a little hub for healthcare. There's several clinics out there, and it's just a great location of being able to get in and out. So that's kind of how we chose the area, and our goal is to have this started and completed in 4 or 5 years. It's kind of hard to say right now since COVID.
Sure.
It's very difficult to get supplies, but after the first of the year, we will start clearing the property and we'll start drawing up the plans.
Awesome. How did you cope through the COVID cacophony? It put a smile on her face.
You know,
I mean,
COVID was a very difficult time in all
Sure,
industries.
sure.
When COVID first started, I was actually at the hospital in Winfield, which is a small rural hospital. That's what Allegiance buys a lot of rural hospitals. Ruston is the largest hospital that Allegiance owns. And so it was very difficult because staffing in a small facility is very, very difficult. But we managed through it. We teamwork. And then when they moved me to Ruston, of course, we had a few more surges. And we took a different thought process when I came to Ruston. Me being a nurse, I like to be hands-on. So I'm not afraid to take care of any type patient that needs to be taken care of. So we just teamwork through all of it. You know, some days you were a nurse, some days you were a housekeeper. You just didn't know what you were doing when you walked in the door.
And some days you're just screaming at the heavens, and then you got through that.
Absolutely.
As everybody. Kathy Hall, our guest here. Now, Northern Louisiana Medical Center has some exciting expansion plans. That's what we're touching on. People are talking about the sign. Tell us a little bit about the Allegiance Medical Clinic.
So in the end of August, we opened a clinic, Allegiance Medical Clinic, which is inside our medical office building at our current location. In that clinic, we have a new pulmonologist critical care, Dr. Tari, and we have 2 nurse practitioners, Jennifer Calvert and Mark Burns. We have added just this past week, we added Dr. Patel. He is a maxillofacial surgeon. He has started clinic and he will see patients 1 day a week and surgery. So that was a big accomplishment to get him here. He's coming to us from Shreveport and will be here 1 day a week for clinic and surgeries 1 day a week. So we hope that will help our community.
Of course. Now, for the naive like me, I had to ask, what is maxillofacial? Help us understand that, because it's an awesome work.
Yes. He is a dentist as well as a medical doctor, and basically he can take care of anything from the neck up. Typically doesn't do inner ears, does a lot of cleft palates, very successful. He works closely with Dr. Godey, which is another very familiar name. So our goal in bringing him here, because there is not this type of doctor anywhere close, is for those children or older adults that they can have surgery here and not have to go far away.
Are you one of these professionals that plan your work and work your plan, or you just show up and field it like a shortstop and take care of the problems one at a time?
Well, I'm like the shortstop. Whatever happens, that's what we do.
And you have time to get into the Rotary. When did you do that, and be a promoter for the Rotary, and how important it is? Because, Kathy, you know, and I mean, there's a lot of these social, nonprofit, benevolent organizations that are on the wane, and people need to know about them because it's a great organization to help others.
It is. So when I was blessed to be able to come back to Ruston, because most of my work career I've not been in my hometown, I've been in other areas. So once I came back to Ruston, I joined the Rotary shortly thereafter. It's a great group. You know, a lot of that is we need young people in it.
That's right.
And so, you know, we have a couple of groups here in town, and so it's a great feeling to see some of these young people get out there and really be involved in taking care of our community. And so we have some great organizations. I love Rotary. We'll continue to be a part of Rotary and serving our community.
You know, what folks don't realize that organizations like this are 100% volunteer. All monies that are raised are recycled, regenerated right back into the community, into other great organizations. And so that's one reason to get involved with. And so I'm using that as a promotional tool for Rotary and for anything else. But everybody, whomever, for those who have ears to hear, sign up, line up, and get involved and do something. Kathy, I just want to thank you for your time this morning. Tell us if there's one thing you want to get the word out about Northern Louisiana Medical Center that the public may or may not know about, what would that be?
Well, a lot of things have changed at Northern Louisiana Medical Center over the last 2 years. Allegiance Health Management, we strive to serve the community. We're not from, another state. We're here.
Mm-hmm.
The corporate office is in Bossier. And Rock's vision, my vision, is to serve the communities we serve in. Because if it weren't for people like us, that wanted to keep hospitals open, then the communities they die down.
Mm-hmm.
And our rural hospitals that we serve, those rural areas, they're so vital to stabilizing a patient so that they can make it to a Northern Louisiana Medical Center. So our goal since the purchase is to make our hospital a service to the community,
mm-hmm.
to the people that we serve, and to improve the health care. And that's our goal. And every day we strive to get better and better. Healthcare is a very difficult field to be in. COVID certainly made it a little bit harder for us. But our goal is to serve our community, and that's what we're doing and trying to improve healthcare every day.
And as you say, community, here we are in Ruston. Ruston is like the hub, and you're not just serving Ruston, it's Northern Louisiana Medical Center. So, maybe community is communities to help the audience to understand the scope of who you are.
Absolutely. We receive transfers from most of the rural areas around us. It may be all the way from Winfield to Farmerville. From Arcadia, there are a lot of facilities. And with COVID, again, it changed so many things. There are times that we have received patients from South Louisiana. So it's about working together.
Right. Well, respecting privacy, as you have to do, if I were to say, what's a miracle story that you have come across in the last year or two, like, man, there's a case that came in, and I got to tell you about that. Do you have one that comes to mind?
Well, I'm going to tell a story about. There's several stories actually
Pick
that you
one.
can tell. Sometimes you'll get a patient in your ER, and they will be in really bad shape, and you're like, especially through the COVID, there's no way they're going to make it, and so. You're doing everything you can,
mm-hmm.
and there's not a lot of hope. And we had someone at our facility that had COVID, and I really didn't think he was going to make it, and he made it.
Mm-hmm.
Was able to go home, and in about 2 weeks he was back at the hospital, and so he was really sick. But we were able to maintain and keep him where he needed to be. Then he had to be transferred because he needed a service that we couldn't provide. But he lived. And he's a young man in his 50s.
Mm-hmm.
And so my husband is down at a cemetery where we volunteer at our hometown down Bienville Parish. And he said, I met somebody today that couldn't say enough good things about Northern Louisiana Medical Center. And I said, really? So he told me who it was, and I just smiled, and I said, yeah. And he said, well, if it weren't for y'all, he wouldn't be alive today. And I said, no. I said, we just did the work that God gave us to do, but if it weren't for God, he wouldn't be alive today. And he said he gave lots of praise to y'all and God as well. This individual was a preacher, and so it was a wonderful story how it was months. He was in the hospital for months.
Mm-hmm.
And he's still recovering. But those are the stories. That's what makes it worth doing. Every life that we can save is important.
Perfect place to end it. Kathy Hall, thanks for your time this morning. Merry Christmas to you and yours. And let us know anything we can do to help get the word out about all the good things that are happening here, and job well done.
Thank you. Merry Christmas.
Oh, thank you. It's 8:34. There you go. Kathy Hall, CEO of Northern Louisiana Medical Center here on the Q, 94.1.